Hey everyone, and welcome back. We're diving into some need-to-know facts about botulinum toxin and soft tissue fillers today. Perfect for all you residents out there gearing up for exams.
Definitely high-yield topics.
We'll cover types, mechanisms of action, uses, and those pesky complications you need to watch out for.
Sounds like a plan. Let's start with botulinum toxin, shall we?
Let's do it.
So botulinum toxin, it's a game changer for so many things, from wrinkles to hyperhidrosis. But to really use it effectively, we need to understand how it works at that neuromuscular junction level.
Right, got to know the basics.
Essentially, it blocks that acetylcholine release, stopping the muscle contraction right in its tracks.
Like cutting the communication lines, no signal, no contraction.
Exactly. And we're mostly dealing with types A and B clinically.
Makes sense. 7 serotypes total, but only A and B are commercially available, right?
That's right. They target slightly different proteins involved in that acetylcholine release, but the end result is the same, muscle relaxation.
Okay, so let's get into the nitty-gritty. We've got Botox, Dysport, and Xeomin, all botulinum toxin type A. What are the key differences we need to know, especially for the exam?
It's a common exam question, for sure. So you're right, they're all type A, but each one has its own unit strength,
Right.
dilution recommendations, and even storage quirks.
For example, I know Botox and Xeomin are diluted to similar concentration,
Yeah, typically, that's right.
but Dysport is way more concentrated.
Much higher concentration for Dysport. And storage-wise, Xeomin doesn't need to be refrigerated. That's a big plus for convenience.
Huge. Any other sneaky differences that might trip us up on the exam?
Good one. One key distinction is those complexing proteins. Botox and Dysport have them.
Okay.
Xeomin doesn't. This affects immunogenicity, basically how likely our body is to develop antibodies against the toxin.
Interesting. So Xeomin might be better for avoiding those pesky antibodies that can make treatment less effective.
Theoretically, yes, that's the idea.
Smart. Before we move on to, actually injecting this stuff, can we quickly recap the FDA-approved uses for each type, just for a quick review?
Sure thing. So type A, it's got a longer list. Glabellar lines, hyperhidrosis, blepharospasm, cervical dystonia.
Oh, right.
Type B, though, just cervical dystonia, at least for now.
All right, got it. Now, let's talk about what we need to think about before we even pick up a syringe.
Yeah.
What are those essential pre-treatment considerations?
Okay, so first things first, when you're reconstituting the toxin, you want a nice, clear solution. No particles floating around.
Right. Clean technique.
Exactly. You can use preserved or non-preserved saline, but there's some interesting data suggesting preserved saline might actually reduce injection pain.
Less pain. Sign me up. And once it's reconstituted, how long do we have?
The manufacturer says 4 hours.
Right. The classic 4 hours.
But lots of folks are comfortable using it for up to 6 weeks if it's stored correctly, at 4 degrees Celsius.
Okay, that's good to know. What about minimizing bruising? Any tips?
Absolutely. We always tell patients to avoid those blood-thinning meds like aspirin and NSAIDs.
Right.
Oh, and vitamin E, too, for about 10 to 14 days before treatment.
Smart. Now, any absolute contraindications where we just say NO to botulinum toxin?
Definitely. Active infection at the injection site, no way.
Yeah, makes sense.
And obviously, a hypersensitivity to any of the ingredients is a hard stop.
Got to check those allergies.
Absolutely. Albumin is in all 3 type A toxins, and Dysport has lactose too, so those are important ones to look out for.
Good points. What about situations where we should proceed with caution?
Patients with neuromuscular disorders are a big one.
Makes sense.
Pregnancy or breastfeeding, obviously. And anyone with a history of dysphagia or aspiration, we need to be super careful with.
Got it. Lots to consider. Now, let's talk more about immunogenicity, the whole antibody thing. You mentioned Xeomin might be better because it has less of those complexing proteins. Why is that?
Right, so our immune system can see those complexing proteins as foreign invaders, triggering an immune response.
Okay, so it's like we're minimizing the immune system's exposure to potential triggers.
Exactly. The more foreign protein we inject, the higher the chance of making antibodies, and those antibodies can make the treatment less effective over time. Xeomin, having fewer complexing proteins, theoretically reduces that risk.
Makes sense. What about those patients who don't respond to botulinum toxin A at all? Any options for them?
We call those primary non-responders, and it's frustrating for everyone. Sometimes it's just a dosing issue, but there can be other factors at play, like genetic predisposition.
Right, so always double-check that dosage.
Always. But if it's not the dose, we might consider going off-label and trying botulinum toxin B.
Interesting. Okay, now let's talk about the actual injection part. We know that units aren't interchangeable between brands, so how do we dose this stuff correctly?
We use normalized clinical dosing ratios to make sure we're getting similar effects across products. For example, for those glabellar lines we talked about, you might start with 20 units of Botox,
Okay,
20 units of Xeomin, or 50 units of Dysport.
got it. So those ratios are key. What happens after we inject? How does that toxin spread? And how long until we see results?
It starts spreading right away and it keeps diffusing for a few days after the injection.
Got it.
Most patients see some effect within 1 to 3 days, and the peak effect kicks in around 2 weeks.
Pretty quick. And how long does that effect usually last?
It varies a lot, depending on the patient, the area we're treating, the dose, but on average, it's about 3 to 4 months.
All right, that makes sense. Before we finish up with botulinum toxin, what are some of the common complications we need to watch out for?
Most complications are pretty minor, luckily.
Okay.
Bruising, swelling, a little bit of asymmetry, those are the most common.
But those are usually transient, right?
Yeah.
Nothing too serious.
Exactly. Very rarely we might see something more serious, like bidosis or a brow drop.
Yikes. Yeah, those are the ones we want to avoid.
Absolutely. So always educate patients about the potential risks and make sure you're seeing them back after treatment to check how things are going.
Definitely. Any final pearls of wisdom for dosing?
Just remember, every patient is different. Their anatomy, their muscle strength, their goals. You really have to individualize the treatment plan. No one-size-fits-all approach here.
Love that. Individualized care. All right, ready to move on to the wonderful world of soft tissue fillers.
Let's do it. I love fillers. So versatile.
So true. But first, what makes an ideal filler, ideally?
That's the million-dollar question. Ideally, we want a filler that's safe, biocompatible, non-immunogenic, lasts forever, easy to inject, and gives us beautiful, natural-looking results every time.
Okay, so the holy grail of fillers.
Exactly. The reality is that no filler ticks all those boxes perfectly.
Makes sense. It's all about choosing the best fit for the patient and the situation.
Right. You got it. And speaking of different fits, let's talk about the different classes of fillers out there.
Okay, hit me with those categories.
We can group them into 4 main classes: autologous, biologic, synthetic, and off-label.
Okay, let's break it down. Starting with autologous. What's the main advantage of using our own tissues?
Well, the biggest advantage is that it's your own tissue, right? So safety is a major plus with autologous fillers like fat.
Right, no risk of allergic reaction or anything like that.
Exactly. It's inherently biocompatible.
But I imagine there are some downsides too, right? Can't all be sunshine and roses?
Of course not. Nothing's perfect. First of all, it adds an extra step to the procedure, right? You have to harvest and process the fat, which takes time and skill.
Makes sense.
The results can be less predictable compared to some synthetics.
Okay.
And there's always a risk of resorption, which means your body might reabsorb some of that injected fat.
So it might not last as long as we'd like.
Mm.
Okay, what about biologic fillers? What are the pros and cons there?
Biologics like collagen and hyaluronic acid are readily available, easy to use,
Okay.
but depending on the type, you might have to do allergy testing because they can be immunogenic,
Got it.
and they generally don't last as long as some of the synthetic options.
Okay, interesting. Now, synthetics. Those are the ones everyone seems to be buzzing about these days. What's the deal with them?
Synthetics are exciting because they offer the potential for longer-lasting, more predictable results.
Okay, that sounds promising.
They're usually non-immunogenic, so no allergy testing needed. But of course, there's always that theoretical risk of long-term complications, and they can be a bit more challenging to remove if we need to.
So a trade-off, basically.
Yeah.
Longevity and predictability on one hand, potential risks on the other. Now, what about off-label fillers? What's that all about?
Off-label fillers are basically synthetic materials that are FDA approved for something else. But, clever surgeons have found they work pretty well for soft tissue augmentation, too.
So we're repurposing them, kind of.
Exactly. But, and this is a big but, using fillers off-label comes with some legal and ethical baggage. You really need to know the risks and benefits inside out and make sure your patient is fully informed and consents to the off-label use.
Excellent points. Informed consent is key. Okay, I think we've got a good foundation for understanding those different filler classes.
Yeah.
Let's dive into some specifics. You ready to get granular?
Let's do it. Let's start with autologous fat, the OG natural filler.
Sounds good to me.
Fat grafting is great, natural, long-lasting. You can really restore volume and contour the face beautifully.
Yeah, I've seen some amazing results. Where do you typically use fat grafting in the face? It seems like it's being used everywhere these days.
Pretty much. Cheeks, temples, nasolabial folds, even the lips. It's really versatile.
So we're basically replacing volume that's been lost, either from aging or other factors.
Exactly.
But I've heard that fat grafting is a bit of an art form, with no one standardized technique.
Yeah, that's true. The techniques for harvesting, preparing, injecting the fat, they can all vary.
Okay, that makes sense. Are there any, like, key principles that can guide us?
Absolutely. One big thing is handling the fat gently, like throughout the whole process. You want to maximize cell survival. And then when you're injecting, it's all about small amounts, multiple passes, creating kind of a lattice work so the fat gets good blood supply and integrates well.
I see. So gentle handling, strategic placement, that's key for good fat grafting. What about longevity? I've heard fat grafts can be permanent. Is that true?
The fat that survives the transfer, that does have the potential to stick around for the long haul.
Okay.
But, fat grafts are still subject to the same rules as any other fat in the body. If the patient gains weight, those grafts can get bigger too.
So maintaining a stable weight is important for keeping those results.
Exactly.
Are there any areas where we need to be extra cautious with fat grafting?
The eyelids, definitely, that's a very delicate area, and we have to be super careful not to inject too much or place the fat too superficially.
Makes sense.
You risk blocking blood vessels and causing vision problems if you're not careful.
Got it. Proceed with caution around the eyes. All right, let's switch gears and talk about hyaluronic acid fillers, or HA fillers as everyone calls them.
HA fillers, a
They're
classic.
so popular. What makes them so great?
They're just so versatile. You've got so many different formulations to choose from, so we can really tailor the treatment to each patient.
Okay.
And they can address so many concerns: fine lines, deep wrinkles, volume loss, you name it.
And HA is already in our skin, right?
Exactly. It's a natural substance that helps keep our skin hydrated and plump. We're basically just replenishing what's already there, giving it a boost.
So no worries about allergic reactions then.
That's another great thing about HA fillers. They're generally very well tolerated, and we don't have to do allergy testing.
Awesome. Now let's talk about specific HA fillers. I know there are a ton of products out there. It's hard to keep them all straight. How do we choose the right one?
It can be overwhelming, but basically you're looking at three main things: particle size, concentration, and cross-linking technology.
Okay, break those down for me. How do those affect the filler?
Particle size basically determines the lifting capacity of the filler and how deep you need to inject it.
Makes sense.
So bigger particles, those are better for deeper injections, restoring volume.
Uh-huh.
Smaller particles, those are for those superficial injections to treat fine lines.
Okay, so it's like choosing the right tool for the job.
Exactly.
Hmm.
Concentration just refers to how much HA is in the filler, which can affect how long it lasts.
Okay.
And cross-linking, think of it like weaving a fabric. The tighter the weave, the stronger the fabric, right?
Right.
Same thing with fillers. Cross-linking makes a filler more resistant to breakdown, so it lasts longer.
Got it. So like for the tear troughs, those delicate under eye areas, you'd choose something different than what you'd use for, say, the cheeks.
You got it. For tear troughs, you might choose a thinner filler, something like Bellatero. But for the cheeks, you might want something more robust, like Juvederm Voluma, to really lift and restore that volume.
That makes sense. Now, I know some HA fillers come pre-mixed with lidocaine. Why do they do that?
Oh, that's just to make the injections more comfortable for the patient. Numbs the area as you inject.
Smart. Okay, let's talk injection technique. What are the key things to keep in mind when injecting HA fillers?
First things first, you need to choose the right needle size and injection depth.
Okay.
That's going to depend on the product you're using and where you're injecting.
Right.
And then, depending on the look you're going for, you can use a bunch of different techniques like linear threading, fanning, or cross-hatching.
And is it still all about those slow and steady injections?
Slow and steady wins the race with fillers. You want to make sure that product is distributed evenly, and that helps minimize the risk of lumps and bumps.
Lumps and bumps are the enemy. And gentle massage after injection helps too, right?
Massage is your friend. It helps smooth everything out.
Okay, so careful product selection, precise injection technique, and lots of massage. Any other tips for avoiding those dreaded lumps and bumps?
Don't overfill. It's so tempting to go overboard, but it's always better to start conservatively and add more if needed.
Less is more.
Exactly. And again, that post-injection massage is crucial. It's going to help prevent those little pockets of filler from settling in places you don't want them.
Got it. Underfill and massage. Now let's talk about the things we don't want to talk about, but we have to. Complications. What can go wrong with HA fillers, and what do we do about it?
Okay, so good news first. HA fillers are generally very safe. The most common side effects are totally expected. bruising, swelling, tenderness at the injection site.
Right, those are the usual suspects.
Exactly. They're usually mild and resolve on their own within a few days.
Okay, so those are the minor things. What about the more serious complications?
The serious stuff is rare, thankfully. But one thing to watch out for is the Tyndall effect.
Oh yeah, the Tyndall effect. I've
Yeah.
seen that before. It's that bluish discoloration, right?
Yep, that's it. Happens when the filler is injected too superficially, the light scatters, and you get that bluish hue.
Not a good look. How do we fix it?
It usually resolves on its own, luckily.
Okay, good.
But if it's really stubborn, we can inject hyaluronidase.
Hyaluronidase, the filler dissolver.
That's it. It breaks down hyaluronic acid so it can help in those situations.
Nice. What about vascular compromise? That's a rare but scary complication.
Definitely a serious one. That's when the filler actually blocks a blood vessel, which can lead to tissue damage.
Yikes. What should we be looking for? How do we even know it's happening?
Pain is a big one. Blanching of the skin, a mottled discoloration. Those are all warning signs that something's not right.
So if we see those signs, we need to act fast.
Absolutely. Stop injecting immediately. Massage the area to try and disperse the filler. Apply warm compresses.
Okay.
And think about injecting hyaluronidase to dissolve that filler ASAP.
This is why knowing your facial anatomy is so crucial.
Couldn't agree more. You gotta know where those blood vessels are and avoid them like the plague.
And always have hyaluronidase on hand, just in case.
Always. Okay, so we've talked about complications. What about longevity? How long do these HA fillers actually last?
That's the question everyone wants answered.
It really depends on the product, the injection site, the patient's metabolism, all those factors.
Okay.
But on average, you're looking at 6 months to a year, sometimes even longer.
Not bad. And I've heard that getting repeated injections can actually make the results last even longer. Is that true?
There's some evidence to suggest that, yeah, the repeated injections might actually stimulate collagen production, which helps maintain volume even after the filler itself is gone.
Interesting. So it's like we're building a foundation over time.
Exactly. Okay, now let's talk about some specific applications for HA fillers.
Okay.
Let's start with lip augmentation, which is super popular these days.
Lip filler, everyone wants it. What are the key things to remember when we're using HA fillers for the lips?
The goal with lips is to enhance, not to create those overfilled, unnatural-looking lips. We want beautiful, natural-looking results.
Right, no duck lips.
Exactly. So you have to assess the patient's anatomy carefully, understand their goals, and then choose the right filler and the right technique.
So it's not just about injecting filler, it's about creating balance and harmony. What about different lip types? Do you approach thin lips differently than, say, fuller lips?
Absolutely. For thin lips, you might focus on adding volume and definition to that vermilion border.
Okay.
But for fuller lips, you might just enhance the cupid's bow a little or create a more pronounced pout. It all depends on the individual.
Makes sense. And I know some injectors use Botox in combination with HA fillers for the lips. Why do they do that?
Good question. Botox can relax the orbicularis oris muscle, which can help avert the upper lip slightly.
Ooh.
Gives you a more relaxed, youthful appearance. So it's a nice complement to the filler.
So it's like a two-pronged approach. Relax the muscle, add volume.
Exactly. Now, what about those nasolabial folds? Those are another big one.
Yeah, they can be tricky. How do we approach those with fillers?
The goal with nasolabial folds is to soften them, create a smoother transition between the cheeks and the lower face.
Right.
We don't want to completely erase them because that just looks unnatural.
So again, it's all about achieving natural-looking results. What are some key things to remember when injecting those nasolabial folds?
Don't overfill. That can actually make the folds look more prominent.
Interesting.
And always, always be mindful of those underlying blood vessels.
Safety first.
Inject slowly and carefully to prevent any vascular compromise.
Good reminder. What about other uses for HA fillers? Can we use them for like scar correction or those under eye hollows?
For sure. They're great for depressed scars, filling in those hollows and smoothing out the surface.
Okay.
And for tear troughs, you can use those delicate, low-viscosity fillers to plump up the under eye area and reduce those dark circles.
So HA fillers really are workhorses.
They really are.
Okay, ready to move on to calcium hydroxyapatite. That's a mouthful.
Let's talk about it. Ka is pretty unique.
Sounds good. What makes it so different from HA fillers?
Well, Ka is what we call a biostimulatory filler. It gives you immediate volume, but it also kicks off collagen production over time.
Oh, that's cool. So it's a 2-for-1 deal. We get the filler effect, and then our body's own collagen chimes in to make those results last longer. What exactly is Ka made of?
It's basically these tiny calcium hydroxyapatite microspheres suspended in a gel carrier.
Microspheres, huh?
Yep. And those microspheres, they're similar to the mineral we find in our bones, so it's very biocompatible.
So no allergy testing with KH.
Nope. Generally not needed.
What did FDA approve for?
Well, it was initially approved for things like vocal cord insufficiency and facial defects,
Okay.
but now it's also approved for moderate to severe facial wrinkles and folds.
So pretty versatile. Where do you typically use KH in the face?
It's a good choice for areas that need structural support and lift, like the cheeks, jawline, temples.
Makes sense.
Also great for deeper nasolabial folds and marionette lines.
So it's like the heavy hitter of the filler world.
I like that.
How long do those results last?
Typically, you're looking at about 12 to 18 months.
Wow, that's significantly longer than most HA fillers.
It is.
Okay, let's talk technique. Any special considerations for injecting Saki?
One key thing is to inject deep enough. Deeper dermis or even subcutaneous.
Okay.
Superficial injections can lead to nodules. Nobody wants that.
Definitely not.
And just like with HA fillers, slow and steady injections are key, followed by a good massage to spread everything out.
Deep, slow massage.
Got it.
Got it. Now, you mentioned that Keki stimulates collagen, which is great, but are there any potential downsides to that?
Well, you do have a slightly higher risk of nodule formation with Seca compared to HA fillers.
Oh.
But usually they're small, you can't even feel them, and they don't cause any problems.
Okay, that's good.
But sometimes they can be noticeable.
What do we do if that happens?
Usually gentle massage, warm compresses, or maybe a dilute steroid injection can help.
Okay, good to know. Any other precautions with Kaleo?
Standard filler precautions apply. Avoid those blood vessels.
Right.
Always aspirate before injecting, just to be safe.
Safety first.
Well,
Okay, ready to move on to another interesting one. Polylactic acid, or PLLA.
let's do it. PLLA, also known as Sculptra, is a really cool filler. It works in a totally different way than HA fillers or Hyash.
All right, I'm intrigued. Tell me about this Sculptra. What makes it so different?
Sculptra is all about stimulating your body to make its own collagen.
A collagen booster. I like it.
It's made of these tiny synthetic microparticles, totally biocompatible, that your body gradually breaks down.
Okay.
And as your body breaks them down, it triggers an inflammatory response. And guess what?
More collagen.
Exactly. You get new collagen formation, which gives you volume and improves skin quality over time.
So it's not an immediate result.
Nope. It's a gradual process. But that's also why the results look so natural, and they last a really long time.
How long are we talking?
I think 2 years, maybe even more.
2 years. Wow. What's Sculptra FDA approved for?
Right now, it's approved for those nasolabial folds we keep talking about and other facial wrinkles.
Okay.
It's also used off-label for a bunch of other things, like restoring volume in the cheeks, temples, jawline.
So pretty versatile. Are there any places we shouldn't use it?
Yeah, Sculptra needs to be injected deep, either in the dermis or subcutaneous tissue.
Okay.
So it's not ideal for those superficial lines and wrinkles, especially around the mouth, eyes, forehead.
Makes sense.
Too superficial, and you're more likely to see lumps or bumps.
Got it. So deep injections only for Sculptra. What about reconstituting and storing it? Anything special we need to know?
Yeah, so Sculptra comes as a powder.
Okay.
You have to mix it with sterile water. Most people add some lidocaine to the mix, too, for patient comfort.
Right.
Once it's mixed, you got to keep it in the fridge and use it within a few days.
Got it. What about the injection technique? Is it similar to HA fillers?
Similar, but not exactly the same. We use a bigger needle and inject deeper.
Okay.
Sometimes into the dermis, sometimes subcutaneous, sometimes even right on top of the bone.
Wow. Right on the bone.
Yep. We call that suprapureous steel injection.
Why so deep?
Well, a couple of reasons. First, it helps those Sculptra particles get to the right spot to really stimulate that collagen production.
Makes sense.
And it also helps to minimize the risk of lumps and bumps forming near the surface.
Right. Out of sight, out of mind. What about post-injection care? What do we tell our patients?
Post-injection massage is super important with Sculptra.
Okay, more massage.
We tell patients to massage the treated area for 5 minutes, 5 times a day for 5 days.
Five. I like it. Easy to remember.
Easy to remember, and it really helps to distribute that product and prevent nodules.
Nodules are the enemy. Okay, so what about result? How long does it take to see the effects of Sculptra?
This is where managing expectations is key.
Okay,
Sculptra doesn't give you instant gratification.
no instant results.
Nope. It takes time for your body to build that new collagen.
How long?
Most people start seeing a difference after 4 to 6 weeks, but the full effect can take several months to develop.
So patience is key with Sculptra.
Definitely.
How many treatments do people usually need?
It depends. Some people just need 2, others might need 4. We usually space those treatments out by 4 to 6 weeks.
So it's a commitment.
It is, but those long-lasting results are often worth it.
Totally. Now, what about complications? Any unique risks with Sculptra?
Most of the side effects are similar to other fillers.
Mm-hmm.
Bruising, swelling, redness, tenderness, the usual suspects.
Okay.
Nodules are possible, but we can usually avoid those with good technique and that 5-5-5 massage.
Right. Massage is magic. What if
Yeah.
we do get a nodule? What are our options?
Massage can help.
Okay.
Dilute steroid injections sometimes work. And if all else fails, we can always surgically remove it.
Got it.
Yeah.
So we have options. Okay. Last filler on our list. Polymethyl methacrylate, or PMM. That's the permanent filler, right?
That's the one. PMMA, also known as Bellafill, is pretty unique because it can give you really long-lasting results.
Permanent, huh? That's a big decision. Tell me more about how it works. What's the magic behind Bellafill?
It's basically tiny PMMA microspheres suspended in a collagen gel.
Okay.
Those microspheres, they don't get absorbed by your body. They basically become part of your tissue, providing permanent volume.
So it's like a permanent scaffold.
Exactly.
What's Bellafill FDA approved for?
Right now, it's approved for nasolabial folds and acne scars.
Okay, so those are the official uses. Are there any areas where we absolutely shouldn't use Bellafill?
Since it's permanent, we have to be really careful about using it in areas that change a lot with age.
Like the lips?
Exactly.
Hmm.
Lips, the area around the eyes, those are no-go zones for Bellafill.
Makes sense. We don't want to end up with permanent filler in a place that's going to sag or wrinkle over time.
Exactly. And we generally avoid it in areas with thin skin because those microspheres might become visible.
Got it. So the placement is crucial. What about allergy testing? Do we need to do that for Bellafill?
Yes, definitely. Bellafill has bovine collagen in it, so we always do a skin test at least a month before treatment.
Okay, better safe than sorry.
Mm.
What about the injection technique? Anything special to keep in mind?
It's similar to other fillers. Small needle, slow injection, but the key is to get that placement right.
Right.
Deep dermis or subcutaneous tissue, we don't want those microspheres showing through the skin.
Got it. And what about aftercare? Anything special for Bellafill patients?
Same as usual. Avoid strenuous activity, stay out of the sun for a few days,
Okay.
and a little massage never hurts.
Massage, massage, massage. Okay, so when can patients expect to see results with Bellafill?
They'll see some immediate improvement thanks to that collagen gel,
Okay.
but the full effect takes a few months to develop.
As the body builds more collagen around those microspheres.
You got it.
What about complications? Anything unique to Bellafill?
The usual suspects again, bruising, swelling, redness. And nodules are possible, though not as common as with some other fillers.
Then if we do get a nodule?
Massage, steroid injections, or surgical removal if needed.
Good to know. Well, wow, we've covered a lot of ground today. Botulinum toxin, HA fillers, CHA, Sculptra, Bellafill. It's a whole world of injectables out there.
It's amazing how much this field has evolved, and it just keeps growing.
It's so exciting. Any final thoughts for our listeners?
Just keep learning, keep practicing, and always, always put patient safety first.
Absolutely. Couldn't have said it better myself. All right, everyone, that wraps up our deep dive into toxins and fillers. We hope this was helpful, especially for those of you studying for your exams.
Best of luck with your exams.
And for all of you, stay tuned for more deep dives into the fascinating world of plastic surgery.